Welcome everyone. My name's Ed Whittaker. I'm the co-chair of JASME, and really delighted to have Hazal and Lydie here today, who are delivering a session on representation in medicine. I've just got a few housekeeping notes to start us off with, and then I'll kind of introduce the pair of them properly. So this session will last about 45 minutes. If you wish to ask a question, please do use the chat field as you've started to do already. For those who don't know, this is just at the bottom of the screen. There's a chat icon there that you can click on. Just please do make sure that you select the option to post on the chat to panelists and attendees if you want everyone to be able to see your comments or questions, and not just the panelists. If we don't get time to answer all the questions, we'll provide a document after this webinar with any questions that we've not had time to address. If you'd like to kind of expand on any comments you're making in the chat, then we will be able to temporarily make you a panelist, bring up your mic and video, if you're able to give us permission to do that on the chat. If we invite you. Please just say that's okay on the chat. And just to note that this session is being recorded, and a video will be available afterwards on the ASME website, along with any support materials. If you're having any technical problems, we ask that you just make ASME aware by emailing events@asme.org.uk, rather than adding it to the comments field, just so we can kind of keep that focused on the session. So I'll just pop that email in the chat now. So that's the email to send any tech problems to, events@asme.org.uk. Great. So as I said, it's my real pleasure to introduce Hazal and Lydie. So these are two fantastic second-year med students at Queen Mary's University in London. And they together founded Journey to Med, which aims to widen participation into medicine by encouraging diversification and encouraging kind of all different socioeconomic backgrounds to apply. And we're really delighted that they offered to deliver this session on representation in medicine. So would you like to take it away?
Yeah, let me just start by sharing my screen. Cool. Can you guys see that? If you could just let me know in the chat.
Yeah.
Okay, amazing.
Okay, so hello everyone and welcome to today's presentation.
We are so grateful to have this opportunity to present to you guys about representation in medicine.
But before we get started, we wanted to, I know Ed's already introduced us, but we wanted to introduce ourselves a bit more before we actually get started.
Yeah.
So my name is Lydie.
And my name is Hazal, and as Ed said, we are medical students. So we are two second-year medical students studying at Barton in London. And on the side of that, we also like to indulge in many different activities.
So one of the things that we do is that we are education content creators. We run a YouTube channel and Instagram page called Journey to Med that we actually started 18 months ago. And we use it as a basis to make academic and lifestyle content, which you can see on screen.
Yeah, and in addition to that, we are also student ambassadors. So I am a student ambassador for QMUL, Queen Mary University of London, as well as being a course representative for my cohort.
And I am a British Holistic Medical Association student ambassador, as well as being a BME representative for African Caribbean Society at Queen Mary's.
And as Ed touched on briefly, we are passionate about widening participation. So we have participated in lots of different events and conferences that have kind of allowed us to help lots of different types of students. So some of the events that we have partaken in include what was it called? The International Virtual Medical Conference, as well as the Healthcare Leadership Academy Conference. And we've also participated in events such as Empowered by V, where we were joined by other creators such as Unjaded Jade and Jack Edwards.
So to support students who are struggling academically and to also encourage them to apply to medicine, during the COVID pandemic, we started up a unique initiative called the Virtual Science Fair, and this allowed around 100 students to present a science-related topic to a panel of medical students, allowing them to gain essential skills like organization, time management, and other essential skills during a time where work experience wasn't really available.
Yeah.
So enough about us, let's get into the presentation. To start off, we wanted to ask, what do you think representation is?
Yep, so you guys can use the chat function and let us know.
We'll give you guys.
Lydie, I can't actually see the chat because I'm sharing my screen. So
okay, that's fine. Yeah, I'll read out. Yeah, so if you guys have any ideas about what representation means in medicine or any adjectives you think connotes with that, then please do feel free to message it onto the chat. So Justin said, students seeing teaching and clinical staff who share underrepresented identities with them. I really like that. Ogechi said inclusiveness, which I definitely agree with. Grace said diversity, which I definitely agree with.
We got any other?
I think that's it for now. So if you want to move on.
Okay. So as we can see, they can have different meanings for different people.
Have two more. Oh. Sorry. Being part of the story, which is, I've never heard that one before. I really like it. And also having a sense of belonging, which I think is so important. And we're actually going to touch on it in an upcoming slide.
Yeah, those are some really good answers. But as you guys can see, representation can mean different things to different people. But for the purpose of today's presentation, we are going to be using the following definition, which is representation in medicine is having a medical community that mirrors the diverse population it is serving, whether that be the same socioeconomic class, ethnicity, race, gender, age. It's important that patients see a reflection of themselves in the doctors that are serving them, and that the cohort or the population of doctors we have is a reflection of the population it is serving.
So another question, what do you think that medical school is representative in the UK?
Again, there's no right or wrong answer. Well, there is some, well, but what's your opinion?
Give people some time to type it and have a think. Oh, so Rashni, I really hope I pronounced that well, said no. Carol said probably not all schools. Donna said, I think they are trying, but improvement is still needed. Grace said not enough representation from across the full range, so socioeconomic backgrounds or ethnicities. Yeah, I agree with that one. Yeah. Ogechi said not sure. I did my medical school in Nigeria. Fair enough. We're getting quite a few answers. Hadis said some schools more than others. Ed said, that's different. Katie said no, due to a lack of socioeconomic backgrounds and certain ethnicities. Sudipta said, I'm from Barts and he has more diverse student population. We're getting quite a lot. Caesar said it's difficult because for UK schools to be representative of the for UK schools, should it be representative of the UK population or the locality of the school? So that's a good question, or a question on the question. And I think when we ask, do you think schools representative, we're referring back to our previous definition of the fact that the cohort should ultimately represent the demographic and diversity of people it is serving. So it's not about a large majority of people being from one race or another. It's more so our diverse population includes people of different social class, different races, different ethnicities, and with the definition we're using, we believe that the cohort should represent that as well.
Yeah.
So I see there's someone says students with disabilities, ethnicity, socioeconomic classes, probably referring that it should be more, and someone said probably not, at least here in Scotland. Amazing. So cool. Well, not quite. So we those of you that said no, yes, it's not as representative. So 20% of secondary schools in the UK provide 80% of all applicants to medicine. Oh, and 7% of the UK population educated at private schools make up 22% of medicine and dentistry undergraduates and 51% of the most influential doctors in the profession.
Alongside that, more than 48% of medical students come from the top income quintile, so the top 20%, whilst less than 6% come from the bottom 20%. And this is quite a shocking statistic in my opinion, but just 4% of the UK doctors come from a working class background. And I think you guys could also think that that's quite a shocking statistic. But basically what we can see from this is in a situation where we want medical applications and medical admissions to be based on simply competence and intelligence, we can see that other factors such as social class and ethnicity do unfortunately play a role in some situations.
Yeah, it plays a large factor in the demographics of medical students and doctors. But the real question is, why does it actually matter? Why are we all seated here today having a presentation about this? Well, the first point we want to touch on is imposter syndrome and alienation. So I think someone in the chat said that I attend Barts and it's quite diverse. And I think it's important to understand, especially when discussing ethnicities, we should be careful when touching on the term BAME. So in terms of ethnicities, for example, my medical school, Barts, yes, it's very diverse because there is quite a large Asian population there. However, in other terms, for example, people of African Caribbean background, it is not diverse at all. So if we use the umbrella term BAME, yes, it might be seen as diverse, but there is danger with referring to that just because it allows us to overlook areas where representation could be included. So imposter syndrome can lead, according to the research we did, imposter syndrome can lead to a decline in the mental health of some students who already perceive prejudices against them. We know that medical school is already a competitive environment. Everyone wants to appear intelligent, everyone wants to appear competent and feel as though they are capable. So on top of that, if perhaps you are singular in your background, whether it be social class, whether it be related to ethnicity or even gender, these things can play into imposter syndrome and a feeling of not belonging and a feeling of alienation, not having a place there, as if you don't deserve to be there. It can feed into these things, which can contribute to a decline in the mental health of certain students.
Yeah, so that was point one. And now going to go into point two, which is about producing better clinicians. So research has showed that patients are more comfortable around doctors they can relate to and are more likely to seek out their services. So those that can relate in appearance, culture, and language. Studies have also shown that people are more accurately diagnosed and treated from conditions by healthcare professionals who are from a similar background. Obviously, in an ideal world, we would want it to be a situation where factors such as race and ethnicity do not play a factor at all in the healthcare you are receiving. However, from the research we have done, the statistics do show that in some places it does unfortunately play a role. However, we can say that I guess this is improving because of the resources that are being produced. So for example, there was a handbook produced by a student called Malone who attends St George's University of London, who's also a third-year medical student, called Mind the Gap. And this is an amazing booklet that shows you how skin conditions can manifest in Black and brown skin. And this booklet did make like headline news because you would think it's almost an obvious resource that everyone should have, but unfortunately it wasn't a resource that was available. And a lot of students, including myself in medical school, will be taught about, you know, different symptoms and different signs, but we would say, for example, the skin goes red in, I don't know, so-and-so condition, but not all types of skin colors will go red. And that's why this handbook was made, and it's been found useful across the country, and it's been actually added into the GMC as a resource that all medical students should use.
Yeah, definitely. So yeah, just add on top of what Hazal said, it does lead into this point. So diversity of ideas and experiences. This will allow better clinicians, because when you're in a diverse cohort with people of different experiences, different backgrounds, you learn more, and it actually improves your interaction with patients who may not speak like you, who may not look like you, especially when everyone comes from a different class, a different background. Perhaps they haven't been raised up with, they haven't grown up within a diverse population where they grew up. It's really important to have that in a medical school cohort, in a medical community, so that there are no surprises when they're serving different patients, so that each patient receives care with no implicit biases, with no lack of understanding, like Hazal said, not being able to differentiate a specific condition on darker skin, because in most of our lecture slides we get taught how to differentiate condition on fairer skin, even though in the population we have today, although people of darker skin might not make up a majority of the UK population, they are still in the population. So it is important to take these things into consideration. So diversity of ideas and experiences. Studying in a more diverse medical school also has positive effects on students' attitudes towards diversity-related issues, which is the point that I was mentioning previously.
Yeah. So we've kind of just spoken to you guys about the fact that there is an issue and why does it matter. But now what can be done? So firstly, you know, they always say change starts from within. Educate yourself, take time to read books, watch documentaries, look at stats and figures, understand other people's experiences to understand that you yourself can educate yourself further. And then point two, you can educate those around you. Obviously, you don't need to be, you know, the most educated person and know everything about the situation to teach others about it, but you know, change starts somewhere. And you might spark an interest in someone who might then go and do more research and then inform others. So it's kind of about starting from yourself and then sharing it to those around you.
Yeah, and our third and fourth point is think about how you can improve representation in your community. I remember that it's everyone's responsibility. I especially want to stress on the fourth point because I think we've all seen what has happened, especially in 2020, and just how much racial aware everything has become. And I think it's really important to not leave the responsibility of more inclusivity, diversity, and representation to a subset, to a specific set of people of an ethnic background. It's everyone's responsibility to put a hand forward, to think about how we can apply representation in different areas of medical school, in different areas of your medical community, in order to improve that overall patient care, which is our ideal goal as healthcare professionals at the end of the day.
Exactly. Well, here are some of our references from the different studies we looked at if you guys are interested in having a look at yourselves. I know you can't really read it right now, so if you guys want, we can send you the links. But yeah, thank you guys for listening, and have you guys got any questions that you would like us to answer?
Thank you so much, Lydie and Hazal. So, you know, as they've said, I'd like to open up for, you know, the rest of the session for any comments that anyone has on the issues raised here, or any questions to Hazal and Lydie about their experiences or perspectives, or anything else, the work they've done through Journey to Med, for example. Yeah.
So someone, Roshni said, totally agree. It's everyone's responsibility. Great talk. Thank you so much. Yeah, thank you so much for listening. And yeah, it definitely is everyone's role.
Yeah. Carol asks, what percentage of your fellow students are from different cultures? Well, in my medical school, there is a predominant amount of people in my cohort are of an Asian population or a white British background. I would say that just maybe under 10 students come from an African Caribbean background. Like
out of 350-ish students.
Out of 350 students. So that is the percentage. So some people might look at Queen Mary's and Barts in London and say, yeah, it's very diverse because it has an Asian population. It has a good BAME percentage, but BAME will cover the fact that, okay, but the representation of African Caribbeans is not that much, is quite poor. So I think is very important to acknowledge that.
Yeah, definitely. Miriam said, what do you think of the teaching on this subject in your medical school? I feel like this is a topic that hasn't really been touched upon in medical school. I think a lot of people, I do know that the Student Council has tried to improve, for example, stuff like representation within lecture slides previously in previous years, as I'm part of the school council as well, but I know that it wasn't really successful. But this year, that is something that we are definitely trying to improve ourselves. So I definitely do think the teaching and every aspect of it can be better, but I guess we need to help with that also.
Yeah. So I don't know where I am.
Donna?
Hi, Lydie and Hazal, for a good representation. In regards to imposter syndrome, what is your perspective on what can cause imposter syndrome? So I think imposter syndrome can be based on many things. Imposter syndrome can be based on things like elitism. So when you have different social classes gathering in one place in a cohort, if a majority of your cohort comes from a private school, not everyone from a private school is, of course, arrogant. This is not representative of everyone. However, if you're in a situation where you are with people, with arrogant people of different social class to you, who feel like that means that they're better than you, it can lead to you feeling out of place, to you feeling like, okay, there's no one around me that looks like me, that's from the same background as me. Does this mean that this is not where I belong? So I do think that's one thing that can lead to it. That's why me and Hazal, we try so hard with our YouTube channel to show that medical students come in different shapes and sizes, in different skin colors, different accents, different social classes. We are both from a working class background, and I think it's important to show other people who are in working class backgrounds and may have factors like socioeconomic factors not on their side, not really encouraging them to get into medical school, that, you know, they can do it too. So I do think imposter syndrome can be based on multiple factors, but that's just one of the forms that it can come in.
And I just wanted to add on to that. I think it's important to highlight that it's not just one factor, it's not just race, it's not just ethnicity, it's lots of different factors that come together. For example, like I'm from North London, and I remember when I went to medical school, a bunch of students were like, oh, you know, you don't look like a medical student because you don't sound like one. And immediately, like, someone like me, I found that offensive, because I was like, how is the way I pronounce certain words making me less of a doctor than anyone else? So it's just small comments like that. It's not always you know, blatantly said out loud, but small comments like that can make someone feel like they don't belong in an environment where they worked so hard to get to.
So 14% of the UK is working class, but only 4% of students come from a working class background. Suggestions on how we address this, and are the solutions affected by intersectionality? I don't really think I understand the second half of that question. Do you, Hazal?
And could you, Susie, could you
elaborate
explain what you mean by intersectionality?
In terms of the first half, as someone who went to who's from a working class background and went to state school, some of the challenges I personally faced was initially things like interview courses, or really expensive courses that are there to support someone getting into medicine. I couldn't afford it. There was already that socioeconomic barrier there. On top of it, I haven't done research on this, so don't quote me on it, and I can't say it's accurately true, but from what I've seen, going to a grammar school for sixth form and going to a state school for secondary, there is a massive lack of resources for state schools in terms of personal statement help, UCAT support, things like that. The small changes that could help you get into medicine is very rare in at state school, is very rare to grab onto as someone from a working class background. So I think to address this, that's a very good question. I think right now there are more widening participation schemes being made available. So some people might get their grades lowered depending on the area they're from. There's a lot of free schemes online or channels like us trying to help people who are facing those barriers and supporting them to ensure that they still get into medical school regardless. So I think widening participation schemes are really useful, and just the more effort and investment is put into that, I think, you know, there could really be a change. And if resources could be balanced so that state schools do receive those resources for people looking to apply to medicine as well. And the second half, I'm not really sure what the question is.
So Susie's just kindly elaborated on that. So she says intersectionality would be two or more identities or protected characteristics, such as male or working class, might be quite different to female working class, ditto different ethnicities, and so on.
Oh, that's a really good question. Thank you so much for elaborating, Susie. I just wanted to add, I think to an extent it definitely is, because once again, I'm only referring back to my experiences and what I've seen. I know that in my state school, it was on call to study, it was on call to want to do well on your GCSEs and excel academically. And I feel like this pressure was extra when it came to males rather than females. I feel like females are always seen to almost mature quickly and just invest more in their studies, whereas males, this is just a stereotype I don't believe in, whereas some people see males, you know, go outside, play football? Why are you inside studying, kind of thing? There's more pressure on males to not study.
Be cool. Yeah.
Exactly. So I think to an extent it definitely does play a part.
Yeah. Next question. There's so many questions. Sorry if I pronounce this name incorrectly, but Myri, I think I said that properly, but do you have any experiences of bias towards yourself as patients, not as medical students, in the healthcare settings from other members of staff? That is a very good question. So as patients?
No, I personally haven't.
No, I don't think so. Not that I can remember, or nothing that has been like that has stood out to me. No. That's a good question though. What do you think we should do to increase representation? I think the main thing is to understand that it can be improved. And I think once you understand the issue, you can always work towards a solution. And I definitely think representation, slowly but surely, it's hopefully going to get there with stuff like, Mind the Gap, the booklet I released. That booklet was released and it gained so much attention, which is what it deserved. And I think just if patients and doctors and the whole community together, if we work together to, tell younger students that they don't have to look like a certain person to get into medical school, they don't need to, be from a specific background. I think all these type of things, if we start from where the issue is, which one of the issues are from just young students thinking they don't even belong, so they don't even consider the option. They might think doctor, me, that's not going to happen, and go down a different path. So I think one of the main places we need to start is, the young children who feel like they can't see those role models and just don't even consider the option to, consider a medical career.
Yeah. What do you think are the main challenges that stop underrepresented groups, BME students, from getting into medicine? Do you think it's more of a lack of students applying or more of a lack of getting offers? Oh, so this is really interesting. So addressing the first half of it, more of a lack of student applying, I feel like that plays a role 100%. We can't force people of a certain background to apply to medicine. They have to want to. We can try and increase diversity all we want, but there has to be a demand there. And I do think that one of the things that plays into it is having a lack of role models. I remember when I was going to interview courses as an aspiring medic, I was always, a lot of the time, the only Black girl in the room. So you might think, oh, why should that matter, and things like that. But as a human being, you do notice these things and you do start to question yourself, is this my place? Like, there's no one else here that looks like me. Is this really my place? For example, as a young girl, seeing a female doctor, I can envision myself in that position and say, I want to be just like her. But the same thing does apply to my race as well. If there's that lack of role models, it already puts you off. It already makes you feel as though there's no place for you there. If an area, a sector is already overpopulated by a specific demographic. So yes, I feel like there is lack of students applying, but maybe it's because they can't. Lack of resources, certain barriers that they can't overcome by themselves, lack of a role model, that could play a part. In terms of the lack of getting offers, I haven't actually looked into this, but one article I was reading, if I find it, I'll definitely pass it on to Ed, said that, implicit bias plays a role in everything. Unfortunately, to an extent, we are human beings, and the less educated you are, the less likely you are to identify that you're having implicit bias in a certain area and, make an active effort to avoid it. So when you have someone that looks like you, when you have someone that speaks like you, you're more likely to actually build that rapport with them. You're more likely to have that familiarity. So as an interviewer, regardless of the amount of training you've got, I feel like if implicit bias plays a role in your ability to build rapport with students, you will struggle to build rapport with students who don't look like you, which could or could not play a role in them getting an offer, in the score you give them, in how well the answer comes across to you. So I do think that the lack of getting offers, I think implicit bias always plays a role. And, that could be one of the things contributing to that.
And I think another thing that's important, which we kind of touched upon, is the availability of resources. For example, I know quite a few students who wanted to apply and who have applied, but because they don't really have that support, whether that be through the UCAT, through personal statement, and just the UCAS application in general, their application just wasn't as good as their counterparts. Their grades were there, the A-star AA, the AAA, that was there. But other important factors such as personal statement and UCAS and BMAT, which other you tend to need quite a bit of help to prepare for those and get those done. if students do not have those resources, or they're not even aware that those resources, like they need specific resources to get those things done to a good level, that can also lead to their application not being as well as their counterparts from grammar schools and private schools, and can then mean they don't get the offers. So I think obviously it's, students shouldn't be spoon-fed. One thing that we believe in is going out of your way to find resources, but some students don't even know that they need to do a UCAT or a BMAT. And I think these type of things, like schools need to inform students about these type of things. And if schools are not doing that for lots of different reasons, whether that be a lack of resources, lack of funding, this can then inhibit the students from getting to where they want to get to.
Yeah. What steps can medical school staff take to support students from underrepresented backgrounds to feel like they belong and have their place in medicine? I think medical school staff need to just be more aware of, for example, the lecture slides they're making. I rarely saw, I haven't really learned how to identify particular skin condition or illness in diseases that just aren't, in skin that isn't fair. A lot of my lecture slides is made up of fairer skin, is made up of, how to identify situations in fairer skin, even though I might have a patient that isn't fair skin. So I think then it's important to take this into consideration in the lecture slides. I think teaching of diversity and representation is so important. We saw with what happened recently with racial tension just across the world, we saw that so many people weren't even aware of the fact that even in England, racism still exists, even though it might be implicit. Racism does still exist. Some people weren't even aware of that. Some people weren't aware of what implicit bias is. So implicit bias is almost making a comment on certain microaggressions, for example, like, oh, where are you really from? Small things like that make you feel uncomfortable. Some people weren't even aware of what microaggressions were. So I think education is so important, and just diminishing these stereotypes that affect how comfortable you feel in a place. I feel like my experience as a first year medical student was very different to an experience of another first year medical student that didn't look like me. I had unnecessary microaggressions, and I do feel like education would have played a big part in teaching people that it's not okay to make certain comments. They might not be, violently racist, but to an extent it is still racist to say certain things that are microaggressions. It's just things like that. I think it's important to educate the cohort, to have teaching about it here and there throughout the year, just so that everyone can feel comfortable as they're working towards becoming doctors.
Yeah, beautifully said. Next question, I believe this is the next question. Has there been any pressure to change yourself? I've experienced my name mispronounced, told to straighten my afro. Even patients say they don't think I understand their cultural nuances to different presentations.
I can't even see that message. Where is
it? You have to scroll a bit because a lot of people just made comments but not questions. Yeah. I think, like, for example, when I got told about, you don't sound like a doctor, immediately the first thing was like, how can I sound like a doctor? So immediately I thought about, do I need to change, the way I speak? And even like going to my lectures, I just like being comfy. So, that might be a tracksuit or just jeans instead of, clinical placement equipment. Of course, when I need to dress smart, I dress smart, but sometimes students want to be comfy, and even getting weird looks for wearing, jogging bottoms to a lecture hall, which I am, completely allowed to do. It makes you want to change yourself. It makes you want to kind of fit in. But I'm really happy that I learned very quickly that you can never really impress everyone in your cohort. And there's just going to always be people who just think differently and have different perceptions and different things that you need to do. But I know that, if I graduate, when I graduate, the GMC will allow me to, be my doctor and treat the patients. And that's the only validation I need. So I've kind of learned to not look for validation from other students in my year group. But Lydie, do you want to add to that?
Yeah, I think obviously validation is a big thing, but on top of that, being told things like, straighten your afro or having your name pronounced, that just chips away at your identity. And I know that sometimes you can feel uncomfortable to be like, okay, I don't feel comfortable with you saying that, that's a microaggression, but we do need to challenge these things and make it clear that you are in this space, you deserve to be there, and you shouldn't be treated like that just because of your appearance. if your other if your other classmates aren't treated like that, then there's no reason why you should be. So I know it can be a bit uncomfortable to call someone out on a microaggression, but you need to put how you're uncomfortable by that comment being made first, and correct that person mispronouncing your name, tell them it's making you feel uncomfortable, and do acknowledge the fact that it is a microaggression to mispronounce, you know, your name, your cultural name. In terms of not understanding someone's cultural nuances to different presentations, I feel like that's the whole point of education. We're not born to. We need to learn these things. So if a patient says that and implies you're incompetent, I think just brush over it. If it's making you uncomfortable, then of course I definitely suggest telling a member of staff about it. But yeah, I do think it's important to acknowledge just microaggressions and, you know, remind yourself that that is your identity, you belong to be there, and you need to challenge anyone that tries to challenge your presence, your value, because you know, you weren't let into medical school out of pity, you was let into medical school because you deserve to be there. So I think it's important to have a stand and know yourself, know your self-worth, and know what to accept, accept, and what to accelerate to a member of staff.
And I just wanted to add on to that quickly. I feel like as medical students, and maybe even as doctors, we may feel like, you know, a patient said something, but I'm not going to bring it up because, you know, I don't want to be seen as I'm being unprofessional, or a lecturer did something, but I'm not going to bring it up because, you know, I don't want the lecturer to, you know, not give me the grades or whatnot. So it's almost like coming from a space of being scared to speak up because you work so hard to get into medicine and be a doctor, that you don't want that to be taken away from you because you brought up an issue. But I think it's really important that you just speak about it anyway, because if you don't speak about it, no one's going to know about it, and you're not going to see change. So I understand that people might be scared to bring up certain issues, but understand that if something is making you uncomfortable and you feel like you're being prejudiced in some sort of way, or there's some sort of bias in your direction, that shouldn't be allowed, and you do need to accelerate that. And I urge you guys to, so that we can see change in places where change needs to take place. Next question.
I don't really, you know, what are your thoughts re-representation of faculty in your medical school? I'm not really sure what that means. So I think we'll just move on to Donna's one. For students who maybe
I've lost you. Okay.
For students who may be having difficulties with the medical course, how do you think staff should approach this? Would you prefer if staff approach students on a regular basis?
Thanks. Hi. Sorry, it's just, related to one of my other points. I you know, it's hard to type. So disability is another unrepresented thing. I can't keep up. This is a brilliant discussion. There's loads of excellent points. So thank you. It's much easier to voice for me at the moment. But what I was asking, I've been a doctor for 25 years, including the last 9 years in academia. I'm an Asian woman from North East London, Enfield. I went to grammar school, but I'm working class, from working class background, etc. So really interesting discussion. But what I wanted to know is, from your point, and I teach at QMQL, but I'm not permanent. So I probably taught you guys. But my point is, in a roundabout way, is what is your impression and experience, if we're talking about students, but actually what about faculty? And we're talking about role models, and I mentioned role models, you've mentioned role models. So what is your impression from a point of view as being students, as regards your faculty, I mean, all of you, as your faculty and the representation that's there, and diversity or lack of it? I don't want to bias that question because I don't know. Every medical school is different. I've taught at 10 in 25 years.
That's true. So in terms of,
so you can start.
Okay, so like in terms of our the lecturers we have and the different types of you know, members of staff we see, whether that be in our clinical skills sessions, in our lectures, in our anatomy sessions, I do believe they are predominantly from a white background, and I feel like I can't name like one black or African Caribbean lecturer we have had. I don't know if I'm just not remembering Lydie, but what do you think?
Yeah, I think in terms of what Hazal was saying, the only time I see people who look like me at medical school are the cleaners in the building. We've had one or two lecturers that represent me, and then apart from that, lecture slides don't represent me.
That's interesting.
People in my cohort don't represent me. Even lecturers don't represent me, and I feel like you know, that is quite it is quite upsetting to see, because you are going to serve people who look like you. So number one, is it really useful to me as a future clinician? And number two, you do want to feel like you belong. So when you are in that place where not a lot of people may understand your culture, not a lot of people may understand you, essentially it can lead to imposter syndrome. And this is actually one of the reasons why I faced imposter syndrome in first year. I found it very difficult to orientate myself when I felt completely alienated in my lecture slides, in my cohort, and with lecturers. Of course, there were a few lecturers here and there that were African Caribbean, but the percentage was very shocking. And I'm sure there are different factors that play
into that. Yeah.
But I think it is disheartening to see, because you do want to see that role model. Maybe I want to do education on the side of being a doctor in the future, but I haven't seen that role model.
Exactly.
I'm not saying that doesn't mean I can't, but it is important to see that representation in front of you. It motivates you more. It shows you, okay, they did it, I look just like them, and I can do it too. So when it's not there, I think it's difficult to understand it unless you've been in that position. But when it's not there, it can be disheartening, and it is very difficult to see and to just acclimatize to. Yeah.
Brilliant.
I think because if you see something, you understand that it's like possible. But if you don't see anything, it's just like, well, it must not be possible. And I think role models in every aspect of life are really, really important. So yeah, when you don't have them, not even literally one, it can be quite disheartening. But yeah, thank you so much for coming up and answering.
Thank you.
Brilliant. Thank you. We may need to call it a day there. It's really, really great to see all of this discussion on the chat. So I would really, recommend people to follow some of these resources that people have been pointing to that look helpful. And we'll try, and if it's okay with you two, we'll try and address any kind of remaining questions, maybe in a send out a document after today. So thank you, both of you, for delivering this session and answering all those questions so greatly. It's been really great to hear your perspectives, and made my job very easily just sitting there with you two leading. And thank you to Lee as well in the background from the ASME events team, who's done all the fantastic organization and logistics for today.
Thank you. Thank you to everyone who joined and was very interactive, asked us so many questions, and gave us some things to talk about. So yeah, thank you so much for everyone who joined.
Absolutely. Feel free to continue the discussions on social media with Journey to Med, JASME, ASME on Twitter. As I said at the start, a video of this session will be available on the website in a few days. Please do be sure to sign up to future bite-sized sessions like this, where we kind of look at specific issues in MedEd in a very kind of short, concise way, so 45-minute sessions or so. In particular, our next session is on Wednesday, the 25th of November. So, oh no, it's not that date must be wrong that I've got down. So if you look at the ASME website, it will be on there, but the title is Defensibility in Admissions and In-Program Assessment, and that's with Dr. Kelly Dorr and Julian Darby from Altus Assessments, and the information for that will be on the ASME website. So thank you again for everyone who came along today, Wednesday, 2nd of December. Okay.
Thank you so much, everyone.